Hi, everybody. So today I'm interviewing one of my friends. Actually, we know each other for a couple of years. We worked back about in 2020. We were going through interview processes. He's actually a graduate of UOP, graduated last year. Correct me if I'm wrong. And he's been working in Wisconsin. And today, the reason I'm interviewing my friend up here, Shamir Khan, is just to start off talking about UOP, his experience, his interview process. And the funny thing is, we both of us got invites together at UOP, at UCLA. Then he got accepted up there. I ended up going towards Colorado, but I'm glad to have my friend up here. And today we might be speaking. You might feel this conversation is a little bit more candid. Since I'm talking to a friend, it might land up into Urdu or Punjabi in between, which is fine. If you're not used to, I'll try to translate, but this is how I kind of talk to my friends. So, hi, Dr. Shamir. How are you doing today?
Hello, thank you so much, Adriel, for giving me this opportunity and arranging this meeting. Yes, we have
So,
been friends now for years, and I still remember in 2020 when we were applying to the school. I would say, it was a lot of fun going through that grinding process of CAAPID. Now we have passed that phase, but yeah,
good,
it
good.
was a time to remember.
So let's start with UOP because a lot of people right now will be watching this because they are currently preparing for their interviews and stuff. So let's hit the nail on the head. So you're a graduate of UOP. Tell us about. If I'm somebody right now who's preparing for the interview, and I personally have worked, but I want you to answer this. If I'm somebody who's preparing for UOP interview, what kind of things should I be preparing at? What kind of questions they will be asking? Because I know there's the one part where they could ask you about the clinical assessment or the written assessment part, and then there's a one-on-one interview. So can you tell us about the interview part, Doc?
Yeah, so traditionally the UOP interviews were planned in a way when they had a clinical session that was like a bench exam and the verbal interview.
Mhm.
So now after post-COVID, I would say that has changed a bit. So now it's more of a clinical assessment, which is online. You don't have to actually physically go there to do a bench exam or anything. But
So
those
no
clinical
bench exam, right? No bench.
For now, yeah, what I've heard, for until the last time there were no bench exam, but there is like a clinical assessment. Some of the schools would go out and ask you the clinical questions. UOP, when I interviewed, it was not that clinical part. It was more of an English language kind of exam where they had a couple of questions, made us write some.
Do you remember one of the questions? Do you remember, like, I know you sent me some of them, but do you remember any one question? I can't look into my
uh,
phone right now.
Specifically, it was very, I would say, walking into trails or something, and you have to just choose one of the option. I don't remember exactly, but one of the part was to answer those questions, and second was to actually write an essay. It was more of, I would say, on the TOEFL kind of a thing, not actually the clinical part. Now this year they might have included the clinical, which I'm not aware of right now. But if it they would ask you clinical questions, I would like to share this experience from the other schools I interviewed in. They're pretty much simple. They would ask you about, any periapical lesion or a very straight, simple questions. They do not expect you to be expert of restorative dentistry or
Okay,
periodontist or prosthodontist. So it's pretty much very straightforward.
okay. Let's take it slow. Yeah, we are going a little bit fast, so let people understand this. So number one, what Doc said up here, that there might not be in the past years they have in the last year they did not take bench exam, but they will take a written part, and in the written part it's more like an English critical thinking kind of part where they will give you a
Yes.
scenario and say what option will you take. And I might have some questions in my messages which I can't read right now, but I can discuss later on if these candidates need help. But so this will be the written part, and then I know Colorado does it, UOP does it too, where they give you a scenario and ask you to write a couple of lines as an essay.
Yeah.
And I personally feel some schools do this just to make sure you can write English, so you can write clinical notes. So that's the second thing. Then what he's saying, that you should be mentally prepared if they ask you any clinical questions, because you never know. And he was mentioning they should not be very tricky. They should be something regarding periapical abscess. And we personally, going through the process, graduating from school, applying to different places, I personally think you should know about different crown preps, the margins. You should know how to treatment plan things like phase one, phase two. You should know a little bit about anything else. I will let you speak from a
Yeah,
clinical assessment
yeah.
part, and
So
take it slow for us.
yeah, so from I would say the clinical point of view, as you mentioned, it can be like periapical abscess or anything. It can be like a crown prep, like a metal, like a PFM. And I think all of the candidates that are in the CAAPID cycle right now, there are some schools that would ask you clinical questions. So these
Remember
are kind of,
UCLA? We had a UCLA. It was during COVID, and they gave us like a list of questions, difference in amalgam and composite, and all of that stuff. Remember
that
that?
that yeah, that was more of a very elaborate exam. I hope.
I wrote crap in that exam. I swear to God. It was during COVID. They sent us online, so there was a list of questions like, why is amalgam better than composite? And this is like second year BDS kind of question. And I remember I just wrote all crap, but it
It
worked
was
out.
also between different materials,
Yep, yep.
amalgam, composite, and other, which was
Usually
I
they
think
love class twos. Every school love to ask about class two, like line angles, box angle, concavity, what's the retention form, and all of that. These kind of
so. I,
things.
I think class two always had takes a lot of importance, like after the ground preps, because I think that was the backbone of any bench exam you would wherever you would go, any bench exam you would sit in. I think the first thing you do is the class two, and second thing they would make you do a ground prep. I think that is one of the reasons, because that is something that you do a lot when you
General dentist.
graduate,
So
yeah, and you
let's
come into
let's let's
practice.
start. I don't want our audience to get boggled up here. Last year they did not ask clinical questions. This year
Uh,
they might. Did they?
In 2021, they did not. In 2022, they did not. About
Okay.
2023, I would not be very sure.
Okay. So what he's saying, in the past years they have not given clinical questions. We are just discussing it. In case they ask something, you should be a little bit prepared. Don't get too much indulgent in it. Now let's get to the interview part. So when the one-on-one interview happens at UOP, do they have a panel? Do they have one person? How long it is? What kind of questions do they ask you, Doc?
So the interview usually is one-on-one. There's one faculty interviewing you, and about my experience and experience from my classmates and my juniors that I got a chance to talk to about the interviews, it's mostly, revolves around your resume. One of the question always was like very widely asked in many interviews, like tell me about yourself. But I rarely got this question in any of my interview, to be honest. So in UP, the interview was mostly like you did this program, or you did any preceptorship or any of your past experience. They just have your resume in front of you. So most of your interview revolves around that. So that is what my experience of the interview was.
Okay.
Interview is not very long. It can range from like 20 minutes. They give you some time, but people do exceed that, like the time slot. It usually ranges between from 20 to, I would say, 40 minutes. If you go up to 40, then that's a good sign, because interviewer is actually enjoying the conversation.
That's the point. I'm gonna tell you something fun. Like I think after your batch, there was somebody who got accepted. She ended up going to SIU. She got accepted to UOP. She was having a very good interview. There was a male faculty. I don't remember the name. This was 2 years ago, and she was giving a really good interview. And the faculty got to the point where he said, "Well, here's a question for you. How many basketballs can you fit in the room that you're sitting in?"
I
He asked her
remember that.
that. So and I told her, like, the reason he asked is because he was enjoying your conversation now, so that's why he was giving you tricky questions just to see how you respond. So just to, for the audience, for the candidates, let me make this simplify for you. So if I am a candidate and I'm preparing for UOP, there are a couple of things I will prepare. Even though Dr. Shamir up saying he didn't get the question, tell me about yourself. But I personally feel that's your identity card. You should always be prepared to tell me about yourself or introduce yourself, or can you tell us something different about yourself. That's an answer that you should always have prepared in your pocket. Now what he's saying that UOP mostly like to ask about your clinical experience, about the things that you have done in the past, maybe talk about your BDS, your postgrad experience, your clinical experience, your dental assisting, you living in US, if you lived in California, if you've done any research work, any preceptorship, which he did in Boston. So these kind of questions. One question they love to ask every school: why should we pick you as a candidate, or why do you want to come to our school specifically? They can always ask you about your teamwork or leadership, because they don't want people who are jerks, right? They want people who can work in team, who are good team players. And you just laughed when I said that they don't want jerks.
I want to add one more thing in this. Usually, what I got in not in my UOP interviews, but in some other interviews, since the lot of the international dentists applying in CAAPID would do also apply in the past applications for the AGDs, GPRs, and specialty programs. So that was one of the question I was asked in my AGD interview that I got interviewed for in University of Connecticut. They asked, just tell me about yourself that you have not mentioned in your application.
Resume.
So yeah, in your resume or in your
Yes, yes.
application. So that is something I would say I was caught off guard.
Did you tell them your secret at that time?
No,
Okay.
I still
All
kept
right.
that to myself. Okay,
Okay.
so that is one of the question I would also like everyone to prepare for, because that is kind of question you would not answer right away if you have not prepared it before the interview, because a lot of the people they would in like they would if someone would ask you tell me about yourself, they mostly would go over their personal statement, and when it comes to the clinical experience, that's all the resume. But I would like you to little bit elaborate, take some time,
Okay.
do not rush.
So what he's saying, just to, I'm sorry, Doc, for cutting you, but what he's
That's
saying
okay.
that you don't want to be scripted all the time. Like if they ask you, tell me about yourself, you say, I graduated from BDS, I moved to US, I did this and this
Yeah.
and this, and you're repeating, and then you're just a boring human being to them. What he's saying is that they can ask you, tell us something that's not on your paperwork. Maybe you do skiing, maybe you're a dancer, maybe you cook, maybe you like to paint, maybe you worked as a barista, or maybe you worked in Target or Staples for a while. Like they want to see your human side. They want to see, can you communicate, or you're somebody who's very scared, not confident, and it's just going to repeat what he wrote down on the paper. So they are trying to look at your communication skill. And one of the things that I do when I prepare people is I discuss with them about their life. And I usually suggest, like, start from your childhood. Tell me, if you're going to start you tell me about yourself, you want to say I was born, like Dr. Shamir up here, I would say I was born and raised in Pakistan, in Multan. My father was a doctor, and that influenced me into the field of medical sciences. I got accepted to a really good dental school, and it really encouraged me through good mentors to pursue a postgrad. I got accepted to oral and maxillofacial surgery in one of the biggest center in Pakistan, but I felt I wanted to learn more. I wanted to do more in my life. So I moved to US. I came for preceptorship in Boston to learn more about things. And that's when I got to know about different advanced training programs about dentistry. And I started researching, and I did some volunteer work. And down the line, I'm fortunate that I got an invite from your prestigious school. I just did his tell me about yourself. But the point is, uh,
Yeah, I would like to add one more thing here, especially Adriel, which I faced as a candidate when we were applying for the cycle. Since you mentioned, I worked in oral surgery before I came to US, so I was in my residency program. So that's one of the question I got in all of my interviews. You are in surgery, why you want to leave surgery and come to US? You are in oral surgery, why you want to leave that and come on the restorative side of dentistry? So that was a question that I was asked over and over and over again. And then I had to actually explain them what pushed me towards going towards the major surgical procedures, from that part to the part where I would just do the surgical procedures that general dentists would do. That was a shift for me, to be honest. And I actually realized it after working 2 years in oral surgery, like what I actually wanted to do as a dentist. Everyone has different passion. Everyone has different, what like difference in their personal choices, what they want to do as a dentist. So whatever your personal resume would be, that is something they would ask out of all, like most of the questions would come out of that. So if you have done any specialization, like you're an orthodontist and you're coming to the general dentistry, so it's very, I would say you should expect this question, why you want to leave ortho and come to DDS as a general dentist, because after DDS you would be a general dentist. Some people would say that after DDS we would still pursue ortho as a specialty program, which makes sense. So most of the questions would revolve around your resume. But
So
as Dr.
here's the thing. Uh, just to clarify, people, Dr. Shamir up here and I have one commonality that we started our OMFS residencies and we moved out of them without completing the whole thing. So that's one of the reason we got these questions. Both of us got these questions, even at UCLA, is why do you want to quit or leave your residency in between and come for a DDS program? Now, if we had completed, like some people who are coming from India are prosthodontists or endodontists, if you have completed, it makes your resume look better. If you're leaving it in between, they will ask you more. But his point is right. They would like to know what's your long-term plan and how are you using your previous education to become a DDS again. You might have done a master's in health administration. They will ask how your postgrad in endo, in masters in public health, or whatever it is, will make you a good general dentist. So you should know that answer. Correct me if I'm wrong, doc.
Yeah, that's right. If you have completed a program, that is like I would say that's a big addition in your application. But if you have left the program halfway, that like you did, I did, then you should expect some kind of, I would say, grilling questions, and you should be ready to answer those in your interviews.
Well, to honestly tell, the OMFS program was 4 years long, and I would have gotten really old. So I thought about I gotta jump out of the boat, and he's younger than me. I was getting old, so I had to move out as early as possible. So coming back to more questions. So do they grill you? Like, do they ask you tricky questions? Do they like put you to difficulties? Like, is that something that happens?
Uh, about my experience in this interviewing process in 2020 with Boston, with UOP, and I also got interviewed in University of Pittsburgh. I would say these interviews are very balanced. Then, it was mostly one-to-one, and no one grilled us. It was all very questions that we were expecting, to be honest, about ourselves, about the resumes, what we want to do, what is the facet of the dentistry we enjoyed the most, what are our future plans. So all of like interviews in these schools were really good. I enjoyed interviewing in these schools, to be honest. They were not very interviews that would have grilled us. One of the interview that I would say was towards that grilling side was actually the interview for AGD. Maybe it can be a reason because a lot of the candidates are DDS who have graduated from US schools, and someone coming from
International student.
foreign, yeah, like the foreign student coming from an international school. That's like a little bit of the shift, because they
Okay,
have to make sure that you can actually, get into
survive.
the program, survive there, communicate well, and your level of skills, because they don't know
So here's
except
a
that.
question. Here's a question I want to ask you. You said most of the interviews were easygoing. I had experience, not personally me, but yeah, one school in UCLA it happened, and I've seen candidates where we have immigrant faculty. Like I know one of the person in my school called Colorado was an immigrant, and like two faculty, and they will grill students because they are immigrants just like the student. So if you lie to them, they would know it, right? And they are very hardworking people who came in, worked their butt off, became a dentist, became a specialist, became a faculty member, and they want to see hard work. And they would grill people. If I'm preparing somebody for Colorado, I tell them like, hey, if this person comes to your interview, no, he's gonna be tough questions. So do you think this happens?
So I would say, especially an international dentist who complete their DDS here and then become the faculty, they have been on the other side. So the more honest you are, the better it would be for your interview. To be honest, you interviewed in Colorado. You studied there. I interviewed there. Colorado interviews. It was a. I would say it was one of the among the DDS schools. They grilled me really well. It's because it's a first of all, it's a panel interview there. For when I interviewed, there were four people, and it was a lot of grilling. I hardly got a chance to complete one of
Who
my
was
answer before
grilling
I
you, the student or the faculty?
students. So I would say the student was there, and they barely let me complete any answer. To
See,
be honest,
here's the thing. These students, I've heard this too. I've been a student. Well, I never got in the. I never used to sit in the panels because it would be a conflict of interest. But the point is, if somebody is watching this who become a student and later on is a part of interview, like keep it easy. Just because you're now in the interview panel, just be easy to people. I've known there are like two people who told me regarding interview at Colorado that the students were very harsh to us. And what happens that candidates try to fake, and that's what Doc was saying, is that they try to lie and the immigrants know your story. They can just, if somebody's coming from Delhi and you lie about your experience in India, he would know right off.
yeah,
And it
that's one of the thing I would say. Since they are the students, they have been there. But my experience in Colorado, to be honest, it was more of the on the grilling side. The faculty was amazing. The I don't remember the name who interviewed me, but they were really easy and they were going very smoothly in the interview. But when it came to the student part, I barely got a chance to
so
complete a single answer.
So come to UOP. So what we are saying together, I had this in UCLA, that whenever you have a faculty that's an immigrant, their style of interviewing will be more straightforward and will be more strict. Don't lie to them. Because I've learned that American faculty will tend to be nicer to your face because they don't want to be a racist to you. You're a foreign trained dentist. They don't want you
That
to
makes
go and
sense.
complain and email. Even they don't like you, they won't show it on your face. That's the thing. They will just act like nice to you. But it's just something you should be aware. And especially I've learned in UCLA, I had a person who was a Chinese, I think, or Asian. And one person was asking me about the non-profit work I did, about YouTube, blah, blah, blah. And the other guy was getting annoyed. After 2 minutes, he was like, let's talk about teeth. Can you tell me how would you restore a teeth? How will you do a root canal? And I was like, okay, he doesn't like to talk about your skiing or extracurricular activity. He want to talk directly about the teeth. And that's how Asian cultures are, right? So
I think that faculty, we had the same faculty that interviewed us. That was, I think, a prosthodontist. Yes, he was
yep.
very much focused on to the clinical part. But coming now to the UOP part, I want to, especially for the IDS, I want you to know in our faculty we have a lot of IDS who
Mhm.
actually graduated from UOP, and now our faculty is there. Our we have a percentage of our even the faculty who are international dentists,
Okay.
and the rest, and for most part the faculty, they have been there for a very long time. So if you would get any ideas faculty, I would say yes, you just be honest. It would be very straightforward. Like you mentioned, it's more straight questions that would come to you. So don't not try to go all over the place before answering the question. Just stay focused. You have to judge which kind of interviewer you have and what kind of answer they're looking for. But if you would get an elderly faculty who have been in GOP for a very long time, then just speak a little bit louder, speak slowly, and they would not ask you the kind of questions that other faculty would ask. It would be more about your personality, a little bit about your experience. So I think in first 4 or 5 minutes of the interview, just you have to judge your faculty, what kind of questions they're asking, their tone in which they speak, and how receptive are they of your answers. So you can get the faculty who would not even let you complete an answer. That they would listen what they want to hear, and then they would move to the other question.
Yeah.
So in that kind of interview, you need to have a very short and crispy answers. But there would be a faculty who would give you all the time, like to speak and complete your answer before they move forward. So I think it also depends on your judgment of your interviewer. That's very important.
Agreed. And I just to add to what you say is because what they did, Doc, this year that they have given the candidates option. You can do it online or you can come in person. And I made videos for people like there are certain differences. When he said speak slower, especially when we are on Zoom right now, sometimes there's a lag in internet. The voice get delayed. So you want to take your time. You don't want
Excuse
to move too fast with your hands because it can create a problem. And I've also made a video when it comes to in person. There are certain things when it comes to your body language, how you present yourself, these things matter too. So what he's saying, the other thing he's saying, you want to judge the room, you want to judge the faculty. I usually say people mirror the energy of the other person. If Doc up here, Shamir up here is talking very energetically, he's very passionate, he has a lot of knowledge, I want to catch up to his communication level. But if he's talking very chill, he's like, okay, what do you want to do? And I would try to mirror him. That's how you try to create a rapport. You want to mirror that other person and communicate at the same level of energy as they are. Uh, Correct me if I'm wrong, Doc.
Yeah, that's right. Actually, you have to make it's very important, like you said, to mirror the energy. Especially, I've seen your videos of how you should say it, how you should, control your gestures and everything. This is very important because in order for you to get accepted to any school, it's very important that interviewer likes you. The one who's interviewing you, they like your personality. You would see a lot of people with more experience than you have. You would see a lot of people with less experience than you have, but you will still see a class which is very diverse. Some people having double masters to the people who just freshly graduated from their schools back home. So it's very important to make sure that you match the energy and you make sure that the person interviewing you likes you.
So here's a question. I've came across a lot of candidates, but you have seen people too. And there are some people who will act very intellectual, like I've done research, I did this back home, my whole family was a dentist, I was this, I did that. And do you think showing off too much resume is not a good thing? And like where's the balance? Is like, should I, if I'm a candidate, and should I be showing, like telling more about, oh, I did a postgrad, I had a high GPA, I got an award, I was in the Colgate festival or whatever it is, and kind of like I should be focusing more on that, or focusing more on the football I played? And where's the right balances?
So I would say when it comes to your achievements, it's very, I would say you should mention all of those, but remember that you already have mentioned that on your resume. Just go to that part, but make it very brief. I think if you would go towards more of like your non-academic side, as a person, how you
Humanly
are.
side, humanly side.
Humanly, yeah, the humanly side would help you more than academic side because I'm assuming if you got any award, any achievement, that's already in your resume, and they have gone over your resume before they are actually, talking to you in an interview. So if you want to briefly go over them, that's fine. But if you would take a lot of time on your achievements, what you already have mentioned in your resume, I think they would just redirect you to a different side of the interview. So I would say it's more of a humanly side, but a lot of people do try to overthrow in their resumes. And one thing I would like to mention, this might be your first interview, this might be your fifth interview, or this might be your 10th interview, but the person sitting on other side is interviewing every year. So he has more experience than you have. So try
Okay.
not to,
Oh,
try not to
outsmart him.
outsmart him or try to outsmart that I can fool someone who was doing this thing for years and I've been doing it for 1 or 2 years. I'm more smart than the person on the other side. So be
Right.
honest. This is
Right.
very important.
And just to
And
add,
one of the questions, sorry to
no, no, go
interrupt
ahead,
you,
go ahead, go ahead.
Adriel. I do got from one of my junior that this year they are actually allowing you to come for the interview in person versus you can
Mm-hmm.
also get the interview on Zoom. So
Mm-hmm.
one of the person actually asked me if we would do on Zoom, our chances of acceptance are lower than going in person. And I asked this, what I just asked this, what makes you think that?
To be
If
honest,
you would elaborate, I was not able to answer that question to
so
be honest.
I one of the candidates that I prepared recently told me that she did UOP online one, signed up for it, and the school said we will calibrate people who are online separately to people who are doing it in person. And the person who was doing online, I was said, why aren't you going in there? She said, well, she's in a different country right now because of family and everything. She could not travel. And it makes sense if you, or most people are mothers or have families or responsibilities and they can't quit or like take break. If you can go in person, it's better because your physical presence or even showing that I made an effort and came to your house to request for something, that shows that you are much more inclined. So number one, it does make a difference. But now you're in a situation, in a family situation, in a financial situation where you can't do it. You can still get accepted. The key thing now is whatever you have, you want to make the best out of it. Number one thing I tell people is your presentation, your interview, this way you set up your room, the way you set up yourself, your camera, your lighting makes a lot of difference psychologically. I tell what he just mentioned, and I agree with most of the things that he's saying. Like he should start his own YouTube channel, by the way. But the point is, he was saying that it's a likability factor. They pick you not because you're the smartest kid in the lot. They pick you because they like you. And one of the way human brain work is we tend to like people who are good looking or people who are extrovert and confident. And one of the way you can be good looking is not to get plastic surgery but have better lighting on Zoom. Trust me on that. If you want, like, just turn off the lighting and see how much difference it makes. Shadow, like, you should know this because if you're doing dentistry, you're going to do dental photography. Lighting makes a lot of difference. You want to work with aesthetics. So if you're on Zoom, your chances can be higher. Number one, make sure your internet is good, your lighting is good, your presentation, your background is good. I've said this, I've seen candidates who had clothes hanging in the back. You don't want to, or who had doors open and you could see the bathroom in the back. Don't do that. I know there are certain
Yeah.
situations where you don't have a very good background. Book a library, all right, or do something. But the way you present yourself, because in 20 minutes, the way I see Shamir, I'm going to judge him from his glasses, from his background, and just associate with whatever I see with his personality. Some people I know had really good paintings in the back, and the faculty kept talking about the painting or the guitar hanging in the back, or maybe a book that's lying in the back. So it's a psychological fact that your presentation matters a lot, especially on Zoom. If you're going in person, your body language, your confidence. The other thing is stress levels. I tell people all the time, like, if you're going, when you fly to a different city, the time zone changes, you didn't sleep all night, you drank coffee in the morning and you went in, and there are like four other people who are like really stressed out, and you get stressed out with them. You don't want to do that. You want to shake it off. You want to look confident. You want to talk confident. You want to show like you own this. It really makes a difference because I tell people, and sorry for speaking more than I should, but opportunities don't come to people who are desperate. It's just it repels you. You want to act like you're calm. I know you, all of us are stressed out at that time, but you want to have that internal confidence in you because that makes a lot of difference. But that, sorry for the long, like, I tend to start
I
speaking.
would I would just like to add a little bit to it. As we mentioned earlier, they would like to know more about the human side, the non-academic side. You having a painting in your background, you having a guitar in your background, you having a books, that would actually give them an idea, a little bit of the
Doorway.
image of, yeah, it's like to expand their communication to that side. What
Yep.
if you just have a cloth hanging at your back would not give a
Would
very
it be
good
fun if I
impression.
put a bar in the back and show some of the expensive I have?
No, that's not a good idea for now to start with. But that's one of the thing. And about UP, I think one of the thing that I would say, especially if you can make it to UP for in-person interview, I think they do prefer the California residents.
Okay. Every
I,
school
I,
does.
j-
Every school does.
every school
Colorado
does
even,
like in state, yeah, the from the
it's
same
easier
state
for
that you
them.
are.
If it's easier, if you're in Wisconsin and you say, well, I can't move, like I don't want to move. It's just risky for them. Somebody who's living next to the block will easily come in, right?
Yeah, that's
Especially
one of the
most
things.
of the candidates are female, have kids, have families, and it's really hard to. So yeah, they prefer people who are like around the block and can easily, and that's with everywhere. That's not just there. New York, NYU love to send invite to NYU people. Boston, Tufts like to send people invites to people who are in Boston. That's I'm seeing a trend in that.
Yeah, and one of the thing with GOP, especially if you have gone over the interview process, the wait list, their chances of you getting accepted from the wait list are very high. I actually have a classmate who got acceptance a week before start of the program.
There
So
are a
the
couple
wait
of
list,
reasons to that. I think because UOP, see, like right now, Boston sends invite, Buffalo, uh, then UCLA, USC, and then in the end comes UOP. So people
mm,
who get UOP acceptance have already acceptance from one other school or two other schools. And then most of them say no. So the waitlisted people get a priority.
yeah.
But
So
don't try to get waitlist in the first place, right?
that's not should be your first plan A,
Yes,
right?
yes. So here's a question. Two important questions before we forget. If they ask me, why do you want to come to UOP? What makes, so here's a question which I can't answer because I didn't go to UOP. You can. What makes UOP unique as compared to other schools? Couple
So
of
one of the
pointers.
so one of the very strong points of UOP, it's very clinically like heavy on clinicals, clinically oriented program. They do have a lot of didactics, but I really love the clinicals. You would get a chance to do anything you want to. You would get, especially they have like, the number of patients you get and the number of procedures you get a chance to do is a lot. You would learn a lot, whether it's a lot of us know how to do fillings. So I would not even mention that. When it comes to crowns, when it comes
How
to
many
denture,
fillings did you came out with?
I did a lot. I
Okay.
went up to like around 100 to be honest
Oh,
before I graduated. So you would get a lot of patients,
that's
and
way
you,
higher than Colorado. Like you told me the other day, you did about 24 crowns.
yeah.
That's a big number.
Yeah, so you would get a lot of clinicals. That's very important. As you go to any school and you just pick up
Okay.
your faculty, their favorite faculties you want to work with, and you get a lot to do. That's one of the things. They're very high in clinicals. From the second semester, you start going to your clinical departments. That's one of the things. So
Okay.
the clinicals start
It's very
very early.
it's very clinically oriented.
Yeah,
What other
and
point you would say?
other they also it's one of the graduation requirement to work on one of the PIP project. It's just personalized
PIP?
project that yeah, it's a personalized interpersonal project. I think it's that but the PIP project is one of the requirement for your graduation, and
No,
you can do
what do you
whatever.
do in PIP?
So PIP is anything, any side of dentistry that you would like to do. So all of like most of my classmates, the my friends worked on this making a temp video. That was for the younger dentists, for the students coming in D1. So they just made the slides, they must made those videos and all that tutorials. So you can do anything. You want to do any project on like implants, like the implants and the
So you have
restorative
to do
side.
PowerPoints in this project and show a presentation.
PowerPoint, some videos, pictures. So it's one of the projects that actually give you a chance to explore any side of dentistry
Creativity.
you want to. Yeah, you want to go grow more in, or if someone, uh, you know, wants to do something in perio, they can do something on implant. Someone wants
Okay.
to go to pros, they can do. My PIP project was actually to write soap notes for all of our peers, and we
So
actually designed that in a way where you just have to add a couple of things, and
so
rest
here's the
everything should be
question.
there.
PIP means you're creating something that your junior classmates can take benefit from.
It can be anything. Your colleagues, your juniors, your fellow restorative dentists. It just depends on the scale of how much you can do in that 2 years.
Okay, good.
There are some students who would sign up for very bigger projects, but most of would sign up for something that's doable.
Okay, makes sense. So here's the next question, Doc. So what other points you have for people? What makes UOP special?
So yes, first of all, the clinical, then this project thing, that's one of the thing. And the other one thing that I would say UOP, it's not actually a plus. I would not like them to mention that in an interview. UOP does not have a lot of
Don't tell
residency
them then.
program.
Don't tell them this. They will still say. But okay, go ahead. Go ahead.
But they do not have a lot of residency programs. So as a pre-doc student, you get a lot. And depending on
So they can just rather, if you're a student, don't say about residency, just say that I got to research and got to learn that UOP has a large number of patient pool. They are serving a large number of underprivileged community in San Francisco, right?
yeah,
Okay.
I would say, yeah, they should be focused on these two. And
What
one
other?
of the thing, one of the thing, if you know someone in GOP, do mention your faculty might know that person.
If he's a good person, you don't want to say somebody's name. Like if you're going to Colorado, don't say Adriel's name, please. I'm just telling you for God.
that
It
can
doesn't mean.
that can land you in trouble.
Yes. So it doesn't mean if you know somebody, he has a good rapport. If you're going to say somebody's name, talk to them and figure out if they are known in a good way in the school. All right. You don't want somebody who's already on a disciplinary action in the committee and
Yeah.
sitting right now to getting expelled and you named him. But since you said that, I've heard two things. These are off the chart. You don't find them written on any paper anywhere. I've heard that Boston and UOP are two schools where the references of a faculty or a alumni matters a lot. Is that true?
I think it is universal, to be honest. In every school, a little bit of the reference should work, and it might work, but certainly something that is something that we I would not like to would talk a lot about that, but yes, that do work.
But the reason I asked is because somebody reached out to me, said, "Hey, can you do give me a reference for Colorado somewhere?" I said, like I had this experience. I could be wrong. I feel Colorado is one of the school who doesn't want your references from other students. Unless you know somebody who's like the dean of school or a trustee or like the mayor of Colorado or Denver or something like that, maybe
Yeah.
that would be worthwhile. But Colorado, as far as I know, doesn't really appreciate that mentality. And I tell people not to do it unless you're very, very sure that that person is very well renowned. I would rather work on my own speaking skill, communicate, make a like try to email them, try to create a connection with them, present yourself in a professional and confident manner, and bet on yourself rather than taking reference from somebody that might not work. It's a risky move.
Yeah, I would say the same about Boston. Since I've done preceptorship there, I also got interview from the BU as well. I think every student is writing the CAAPID number and their name for their people they know, and most of them would say they are cousins, and he is a good friend. So that's a lot of thing that happens in Boston as well. So I think yeah, you should actually figure out how that person's repute is in the program, and I think it's better if that would come from someone influential, like chair or some dean or mayor of the Boston, not actually
Yep.
because a D1 or like a IDS first or a second year student would not have that kind of a say.
Yep.
Would
And here's the
would
other thing. I'm sorry I'm cutting you because the countries that we are coming from, people coming from Middle East, India, Pakistan, the way we use our references is very different, as there are references that goes on in US as well, but we totally rely on references. Like I would be sleeping in my bed and saying, Shamir, can you give a reference through your dad and I will get pass in my exam. And that's how it works in these countries, right? In US it doesn't really work that way. So again, my best suggestion would be, if you want to bet on something, bet on yourself. Like create yourself in a way that you can make the most impact and influence the decision rather than taking other people's shoulder to take the shot.
so I would say I would just especially this thing for the candidates from Indian, Pakistan, and Bangladesh, the South Asian side. There's an old saying, in Rome, do as the Romans do. So the reference-based system in US is not as it is back home. So
So be critical.
the kind of reference that work in these systems are a little bit different, and they're on a higher scale. So
Okay.
if you want to bet on anyone, or it should be you yourself, betting on yourself, like you mentioned.
Okay.
Just bet on yourself. You would have higher chances that way.
So here's another question, Doc. So any other point that you would like to mention that makes UOP special? I know They made a new campus in Sacramento. So they are trying to make their facility bigger. They are trying to help more people, more underprivileged people. You also mentioned that Dugoni was a doctor who really believed in super GPs, who wanted their general dentists to be prepared in a very well-rounded way, right?
So
Any other
yeah,
point?
so one of the things, yes, thank you for mentioning these. UP has outreach programs in different community centers that would give that actually would give you an idea how it is committed to serving the underserved population. And UP is also one of a very, I would say, UP is a family. They believe in being in family. Once you enter into
Who
that
charges you
UP,
$350,000? That's the kind of family these dental schools are. Sorry.
yeah, yeah, that's the kind of family, but they believe in family connecting. They're very social mixers. The outreach program is good. They're expanding their ideas class. The movie, like they made another campus in Sacramento. I would say that would be a really good opportunity since, in Sacramento you would get like a lot of experience of the patients. Other than this is what I'm assuming. I don't know about it. I think it would be more affordable to live in Sacramento than in San Francisco because I have lived there for 2 years. It's very expensive to live in San Francisco.
Well, people love living in California. So, okay.
That's right. That's
Right
right.
now, on average, what's the average loan a UOP student comes out with?
I would say
Monthly.
I know about the IDS International Dentist Class because traditional DDS is 3 years, not 4 years. But I never got a chance to talk about numbers. But I would say an average, if you loan on an IDS student, is
Living
around
institution.
living and tuition would go up to around 350.
Okay, Colorado was around 3 to 350 as well. And I was talking to Chamir about it. I think it's reasonable because if you go to Columbia or UIC, then you're hitting 500,000. So those are big
Yeah,
numbers. So right now, I think if you come out around 300, you can pay it off as a dentist still. Like
yeah.
Dr. Shamir up here is making millions of dollars as a dentist in Wisconsin. Not to
I
talk about his
wish.
numbers, but I
So
mean,
I was, yes, one thing I would add, I was under the impression that other schools would, the people would end up getting loan around 250, but Dr.
UAB
Adriel,
is cheaper.
yeah, yeah. So Adriel cleared me that so most of the loans would go around 300,000. I actually got this question from one of my junior who is in UCSF that it's a 3-year program and the amount of loan that he would have by end of the program. So I would my always first answer to that question is your main goal is to get into DDS and learn. That's one of the reason why you opted to come into DDS. So loan always is the secondary. The
And
first
and
goal should be to get into a good school, and when you are there, learn to the max amount you can.
and
You
what you're
should, if
saying,
you have to stay after school, just stay after school. You have to go after the faculties, go after that.
but
That
but
should be your
here's the
first thing.
thing, Shamir. Sorry, I'm cutting you off,
Yeah.
but there are some schools like UCLA doesn't get any patient at all. Like they get very few patient. Even if you run around a lot, you're just gonna be doing more research. Sorry to UCLA people, but I have to say this. So his school actually had more patients, even more than Colorado. So that's a good part. You NYU has a lot of patients. USC has a lot of patients, but not every school has the same patient. Like
I
Boston
would
doesn't.
say one thing. I would say one thing clearly, please. That's an. I'm telling you, do not mention that in your interview. But the schools who do not have a lot of residency programs would give you more patients. UCLA has every residency plan, like program on the planet that dentistry has to offer. So that is one of the reason their pre-doc students would end up not getting a lot of patients, and a major portion of their class would go into specialization.
Yep,
So
definitely
UOP does not have a lot of residency programs. They just have endo and ortho. That's it. So that's one of the reasons you would get a lot of
get
patients.
more patients. Yep. The
Yes.
the other thing that if somebody asked me, I made a video on this too. That UCSF has this much loan. Well, I asked them, if you don't want this, what's the option B? Do you have another acceptance? If you
Yeah.
don't, then this is your best option. Just go in, get your DDS, and then pay off your loan. If you have two options, like you've been accepted to TUF and UIC, then compare, right? If you don't have any options, then just shut up and get your DDS. Like, what are you like? There's nothing to compare. And I think
That's very important. That's very important to realize. If you have other acceptances, then you can talk about this part. You can talk about like I would choose this one or that one. Like you got many acceptances, so you had this choice of choosing schools. But if someone would not get a lot of acceptances, it's only one acceptance. I would say rather than calculating the loans, how much years that you like it would take you to return the loan back. I think the you should focus more on actually getting into the school and trying to actually go over the school and talk to the people who have graduated from those schools. So actually you can know where to work more, and what school would take care of it easily, where you do not have to put a lot of energy. So that's very important for you to realize.
makes sense. So, c- anything else people should be thinking about UOP? Uh, how was your life up there? How's the stress level in school? How was it overall? I know the living was expensive.
So UOP traditional program is 3 years and IDS is 2 years, so it's a lot of work. If I would say you would be going out every weekend doing party, no, sir, sorry. You would be pretty much doing your works, your assignments, you're preparing for your exams. So you would get time for yourself, but not a lot of time. So
That's
it,
that's that's how most dentist schools are. I think we discussed this. We age
yeah,
you during the 2 years of dentist school, you ate like 10 years because
I
there's
think
so
so.
much
That's
things
right.
thrown at you and you have to catch all of them. And we aren't young. Like if I we were he's younger than me, but if I was doing that at the age of 25, you have more, like, you can deal with more cortisol. But at this time they are making you do so many things, and there's loan on you, high expensive living. So I tell people, manage your stress early on, because Shamir, here's the funny thing. People reach out to me, say, oh, CAAPID is very stressful, I'm going through breakdowns and stuff, and I say, this is welcome to dentistry in
Nothing.
US.
Yeah,
Yeah.
that's the thing. So one of the thing I actually learned from you, and I want to thank you for that. Like always do. Usually when you join a program, I want you to know the pattern. You have been struggling. You get into the school, and your dopamine levels are very high. You're excited that you're starting a new journey. Then boom, you face the reality. It's grinding. It's not fun. It's actually the grinding. So first year might pass, and from the second year your dopamine level starts to a little bit come down, and anxieties and frustrations start to surface up. So one of the things that you always told me, and I'll try to follow it, please do have a hobby, do exercise. Like you told me, I used to go to gym every day until the day I graduated. But after that, I have not been very particular about that, but that helped me a lot. To manage your stress level through frustration, you need de-stressor. So I used to work out like Adriel used to do. This is what he recommended me. That helped me a lot. So
Yeah,
please,
I
during
think
the
overall,
program, do not burn yourself out.
and to be honest, Shamir, you're working as a GP. I'm working as a GP. We do a lot of surgical stuff, and you make money. We make money, but the point is, US stress levels are so high. The more money you make is directly proportional to stress, and there's no way
That's right.
out. Like there's no way out. I keep thinking, how the hell Trump walks around like a 80 years old guy with so much stress and money, and he's surviving. And then you
Yeah.
just have to build a thick skin. You need to have a routine. You need to keep yourself positive. You need to do eat healthy or whatever, blah, blah, blah. Have a massage therapist, whatever works for you. Otherwise, people indulge in alcohol. US has a large number of, you deal with a lot of, you see patients who are in opioid crisis and stuff, right? Like people
Yes.
who take fentanyl and then they go through rehab. US has a lot of psychological stress issues. In our countries we don't have electricity, but we are still happy because that's how it works. But in
Yeah.
this country, people, when especially when you start making money, now I realize why dentistry has a high suicide rate, why there's a large number of dentists you get to hear go on cocaine or became alcoholic or takes drug. Like there was somebody in Ohio who's kicked out of their third job because that doctor, he's actually from Indian origin, and he's the third time kicked out because his staff said he takes some drugs during doing patients. And I can understand because to me, does this happen to you? If I go to a restaurant or anywhere and any place I'm sitting, and if I tell people dentist, literally their eyes change like this. Oh, you make a lot of money. I'm like,
Yeah,
yeah,
that's the
for
thing.
the world I do.
For
like
the world, you do, right?
yeah, from the world. Like I could see the dollar sign coming into their eyes. I'm like, you think it's fun, but in the world we live in, sometimes you just spend money just to get rid of your stress. That's all. And
Yeah,
especially
that's
you
right.
live in Wisconsin, I live in Ohio. These are not like Las Vegas. We aren't. So it's very easy, calm life up here. Everything closes at 8, that kind of thing. But again, the point that we are saying, that you need to start managing your stress during CAAPID. And he used to, I was stressed too, but he was stressed too when we talked early on. When he was applying to schools, he was getting interviews, weren't getting acceptance. So here's a question. What helped? I know that you went through preceptorship, you were trying hard, you were coming from Pakistan, there was a lot of money you were putting in, you were being abused by people, like going through this process, but you were not getting acceptance. What helped you to get accepted? What was the change in mindset? How did you manage to finally grab that thing and pull it towards you?
So I would say, especially over, I have applied for 3 cycles before I got into the dental school, and I got a chance to talk to a lot of people who were in this CAPID process who actually got accepted, the ones who were not getting accepted. I have seen people with zero experience getting into the schools, and I've seen people with tons of experience and still not getting the chance in. One of the things that over the years that I have realized, I think it could be something that you're emotionally attached to, you really want it, you're working hard towards it, you might deserve it. But every candidate must realize, which I did not at the time I was applying to the schools, realize this part. A DDS or international DDS seat for a school is business. For you, it can be your career, it can be your emotional attachment, it can be something you really worked hard to achieve. But for the
Passionate about.
school, you're passionate about that part. But for school, it's business. So if school has to give an offer letter, especially, they would not say that. It's something that's not written there, but it's there. Someone who is here, who already has the visa status, who can get the loan easily, is already a preferred candidate by the school. Someone coming from outside
So
of US
what did you do?
requiring.
What did you do that finally flipped the decision for you? Because you were working, like, what do you feel like was the final things that really made it? Did you do some volunteer work? Did you get more experience? Went to Duggan, Stevenson? What was the things that really you feel like, okay, finally this helped you?
I think one of the couple of things I would say. First, I was persistent in it. I was not ready to give it up. I kept adding my clinical experience. A lot of the people would work here. I was working in US as a volunteer assistant because you cannot work here as a dental assistant when you are visiting US.
So
So I
this
was
guy
just
wasn't doing his oral surgery back home, took days off, took the break, came to US and worked as a dental assistant non-paid.
I'm not like an observer. I would not even
Yeah.
say dental assistant, just getting more of the clinical knowledge. And I think instead of we're shadowing into the practices, what would help you more is actually the preceptorship programs. These
Okay.
preceptorship
How
programs
many did
matter.
you do?
I did one that was from BU, but I've heard UCLA has more, and they are like six
They
months
have
to
one
one
in
year.
implant, which even give you F1 visa.
Yeah. So one of the thing I would say, these preceptorship programs really helped my resume. Apart from what I was working back home as a dentist, and these preceptorship programs, that was something that changed my application. You
Okay.
can work, you can shadow like I did. I would say that would help you, but not a lot. Someone who's working as a dental assistant would help them a lot. But especially you cannot work while you're visiting US, you cannot work as a dental assistant. That's one of the things. You can just shadow. I shadowed. But you can do preceptorships, you can get into the programs that different universities have to offer, like Adriel mentioned about the implant program in UCLA. So these kind of programs help you to, shape up your resume in a way when you would be interviewing. I would get in all of my interviews, everyone would ask me about, like, how was your experience in Boston? What were you doing there? So that was something that helped me. I think you should offer these preceptorship programs. They would really shape your resume up, and do pre- be prepared to answer the questions as well. Just do not like spend days there and come back. Make sure you know about that program, learn. At least you should be able to talk about that program. That would also help the interview.
So you think your clinical experience over time of 3 years and being persistent was something that really helped you get
Yes.
accepted to the dental
Yeah.
school? That
That,
finally
that,
made
that,
it. And as you mentioned, one thing, he said a very important thing, that he did not get accepted earlier. And by the time he got accepted, or now, he says that these schools, you need to understand, it's a business. You might be very passionate. You think education is a religious, righteous duty. Being a healthcare worker, becoming a doctor is like becoming a messiah. It's like a religious thing. I'm going to be
yeah.
helping human beings. Yeah, good for you. But the point is, the schools are doing a business. It's a negotiation. It's not a charity. They are giving you a seat which is worth $350,000. You should be able to bring that money on the table. Number one, they want to make sure, and he can tell you about that. They want to make sure you bring that money. Otherwise, their money will be wasted. The other thing is, if you were doing a business with anybody, you have couple of different options. You want to pick a candidate or pick a person which is better than the other person, right? So you want to work on your application, just like he mentioned, doing clinical experience. Being He did Duggan's preparation as well, right? Duggan or Stevenson, you took that.
I took Duggan's, yes.
Duggan's, he was I remember he used to tell me that I'm at a friend's house, I'm cutting teeth, I'm preparing for this, I'm doing that. He was doing a lot of preparation. He was stressed out, but he was on something, like doing something. And I think building that up and staying persistent and knowing the right mindset. What are these people looking for, and what am I bringing on the table? You want to be realistic about the situation. Don't live in la la land. Don't think, I will go in and smile and say, I'm going to work hard, they will accept me. Yeah, they might, but this is a business. Again, you need to know what they are doing to you and what are you doing to yourself. Otherwise, like in dentistry, after 6 months, your neck will hurt and you have a $500,000 loan and you don't know
Yeah.
how to pay, right? Corporates will abuse you and you're just getting thrown one place to the other. So, Doc, any other thing you would suggest to the candidates? Anything else before we end this? Anything else you would like to talk or suggest people?
So one last advice would be always in your interviews, be honest, be upright. Do not just be like I would like you mentioned. I would go there, smile, they would take me. I would let them know I'm a very hardworking person. Every candidate says that.
Everybody is. Yeah, to be honest, everybody's
To me, yeah,
hardworking. Who isn't?
who have come to this point for sure, they have worked hard to come to the point where they're getting interviews. So tell about yourself. You would talk about anything. Like I can talk about anything. Adriel can talk about anything. But I want every candidate to talk about what's unique in them. That where your application would stand out the most. That where you would in your interview would stand out the most from other people who are giving interviews with you. You have to tell them the unique side of yourself. You can be a dentist who knows something about doing magic. You can be a dentist who is very good in singing. You can be a dentist who would have an amazing hobby. So it depends on you. We can talk like you we can I can tell you you talk about clinicals in GOP, about like the POV project, that you get a chance to work on that part. You get a chance to do a lot of patients. You go to community outreach programs with GOP. They have like the student body, where everything funnels to the student body to the higher ups. It's very organized. You enjoy. I was also the part of the body, but you enjoyed that part. But in your interview, what would help you is what will you tell them about yourself? What you would tell is unique in you that differentiates you from the other candidates. And when I say unique, it would not be that I have worked 12 hours a day. It would not be I have done a fellowship. It would not be that I'm applying for 3 years. If you're applying from 3 years, I think the first question will be, what have you changed in your application over these years? You should be ready with that answer.
Okay. Makes sense, Doc. Makes sense. All right. So, people who are watching this, if you have any questions, if you want preparation for interviews, you can reach out to me. Dr. Shamir can vouch for me. I have worked with a lot of people he has sent to me. I've worked with their interviews. And if you have more questions regarding UOP, you can write in the comment box. You can text me. Are you on social media? Do you want people to contact you? Because if I put your contact up there, you're gonna have a lot of messages up there. So it's up to you.
So I would say all of the people mostly that contact me through my friends and to the people I know, I always redirect them to you. I would say I have n- I have done my interview part. After that, I was busy in other side of that, like growing into my career. But Adriel has been doing this really well. My even the people, some of my people from my family who actually interviewed for the ADS, I actually referred them to Adriel to help them out. Since Adriel is doing it on a bigger level, I think he would be a better resource than
And
I can be.
I paid him to say this, by the way.
Yeah, and you're not getting that back now. So I think Adriel is a big resource, but if anyone needs help, you can discuss with, Adriel. We can, one before an interview, we can just arrange a session where both of us could help you out. But I think still I would bet on Adriel more than myself for the interview preparation part.
So to make it short, if you're watching this, if you have any questions, you can write in the comment box. You can reach out to me WhatsApp. If you really want to connect with Dr. Shamir up here, you like him, you want his number, you want to talk to him, I can share his number too. But you're more than welcome. If you have any question, write in the comment box and like the video and subscribe to the channel. We like your support and we wish you all the best and all the best for your interview. Thank you.
Thank you, guys. Best of luck.
Thank you. Thanks, Ramir. Take care.
Thank you.
Bye.
Bye.